there, and welcome to Dog Liaison. My name is Jenna, and we're here with Dr. Pachel. If you are just tuning in and you're interested in seeing a shorter version of this interview, I would recommend you open this link right here in the new tab. And then if you're interested in listening to this full interview, then feel free to stick around. But if you're just looking for the highlighted version, we have a condensed version of this video that you can open up and view right away. If you're sticking around, then thank you so much. We're so excited to have you tune into this conversation. We are going to have a interview. You can listen to this sort of like a podcast if you'd like, or if you're interested in seeing our pretty faces talk, then feel free to watch this on your TV if you'd want. Otherwise, we hope that you can enjoy tuning in. So we're here with Dr. Christopher Pachel. He is a doctor of veterinary medicine, a diplomat of the American College of Veterinary Behavior, and a certified animal behavior consultant, which is big, fancy jargon for veterinary behaviorists. And if you don't even know what that is, that's okay. That's what we're deep diving on today. We're going to talk about why you might consult a VB, what to expect from them, and how they can better support you and your dog through any sort of behavioral or medical complications. So there are actually less than 100 VBs, veterinary behaviorists, in the US. And so if this is the first time you're hearing this, or perhaps you were referred by a trainer or consultant saying, hey, you need to go check out a veterinary behaviorist, and you're like, what the heck is that? It's okay. There's not too many of them in the world, so it would make sense that it would be an unheard thing. So today we're going to break down exactly what they do and how they can support you. Now, Dr. Pachel is the owner of the Animal Behavior Clinic in Portland, Oregon. He has been practicing veterinary medicine for 20 years, and within this industry, within my professional world, Dr. Pachel is a highly revered, sought-after speaker. We absolutely adore Dr. Pachel. He has done so many wonderful conversations, and what I'm going to do is I'm going to link in the description some of my favorite free resources and chats that he's done. So afterwards, if you're interested in absorbing more of his brain, you can go check out some of those links in the description box. Thank you so much for joining us, Dr. Pachel. I'm so grateful to you. Thanks for tuning in.
Well, thank you, Jenna. I appreciate the opportunity to be here and really to highlight, not only some of those other conversations which you mentioned, so bless you for that, but also really diving into this conversation about what is a veterinary behaviorist and why might you benefit from one, and how do we collaborate with other behavior professionals and with other veterinary professionals, and what does this entire conversation look like? So the opportunity here to really dive into that conversation is something that I'm truly grateful for. Thank you.
Absolutely. So in the simplest term, if you had to give yourself a tagline, what would you say is a veterinary behaviorist in the simplest, simple terms?
My gosh. So you've seen me lecture before. I can take even the simplest of questions and do a deep dive on it. So we'll kind of expand it and then bring it back in here. The easiest way to understand that is that a veterinary behaviorist has a thorough education, both in the veterinary medical aspects of animal care, as well as a comprehensive understanding of behavioral methodologies and emotional disorders and all of those things. So I sometimes think about myself as almost like a translator of those two worlds, with the ability to kind of lean in one direction or the other, depending on what an individual animal or pet owner really needs from me. And so it's that sort of broader skill set, or that broader toolbox, that allows me to sort of mix and match the solutions, which in some cases might include application of medications or medical therapies, really looking at individual diagnoses or problem solving that element. And then in other cases, really helping to tease out exactly what's going on from a behavior modification protocol, and really helping to really figure out what's going to be the best solution for a particular animal. So all of that sort of boiled into a nutshell for me is what a veterinary behaviorist really is and does.
Yeah, it's a very distinctive, very unique education, but also specialty in that you have both lenses. You can kind of, like you said, you can kind of jump between the two different roles, if you will, as needed for the dog or for the patient, for the client. So I mean, how would you describe yourself being different from, say, a trainer or like a behaviorist that might call themselves a behaviorist on TikTok, right? Like, what makes you so much more of a behaviorist than these other behaviorists in the world?
Yeah, I love that. So when we think about the term behaviorist, it can be loosely applied in a lot of different ways. So technically, anybody who has studied animal behavior in any aspect can technically utilize that term. So it does get thrown around a bit. And I do think that for the average pet owner, and even actually for a lot of people in the industry, it's a little bit difficult to tease out what does that actually mean. When I use the term veterinary behaviorist specifically as that combination of words, for me, that means this is an individual who has gone through veterinary school. So you have an understanding of medical issues, you understand systems, you understand how the body works and functions in health and disease. And you have the ability to really tease out those individual components in a way that allows us to get to the point of a diagnosis, which then informs our choice of therapeutic interventions. So that veterinary behaviorist has that veterinary foundation and has gone through additional education, typically consisting of anywhere from 2 to 5 additional years of study, where we are working with board certified veterinary behaviorists from a mentorship standpoint, learning how to apply the information that we've memorized and learned. We're going through graduate level education as well. We're also doing primary research to really understand how do you answer some of these questions? How do you generate that critical thought process that allows us to really approach each of these cases, as well as the scientific body of literature, in a way that allows us to really distill that down, and not always thinking about it at the academic level, but rather saying, cool, that's all great, and what does that mean for Sparky?
Right.
What do I do here? How do I take the meaningful nuggets and say, well, in this study we learned this, and in this study we learned this. What does that mean for us here?
Mm-hmm.
So for me, that, thinking about that veterinary behaviorist, it's pulling all of those skills together, and also understanding, both as a veterinarian and as a veterinary behaviorist, we're intervening, right? We're taking those tools and we're putting them into practice, which is perhaps a little bit different from some of the behavioral fields that are more observational. Which is, they're not necessarily better or worse than the other. They're just different,
Right.
If we're looking more from an ethology standpoint and describing what we see,
Right.
that gives an incredibly important layer of understanding, and is a bit different from the way that we look at this as interventions. So it's trying to pull all of those pieces together in a really informed and responsible way.
If I was a common dog owner, right, and I take my 2-year-old dog to the vet, and I've been going every 6 months, and I have a good working relationship with my vet, and my vet tells me, oh, I understand dog behavior. How might someone be able to delineate the difference between like a generalized understanding of dog behavior from a vet perspective versus a veterinary behaviorist, which has a little bit more education and applied knowledge than the average vet?
Yeah, it's a tricky line, right? Because every veterinarian has a different experience, has a different background. I know veterinarians who work as general practitioners who have an extensive knowledge base around the field of behavior and have many of these same attributes that I just mentioned. And yet, I also know that depending on the practitioner, depending on where they went to veterinary school, and even perhaps when they went to veterinary school, the level of education that they themselves have received varies quite a bit. And so it's something that, that I have to remember, that even if someone has been going through the work of going to conferences and applying that sort of level of curiosity and trying to fill in the gaps in their knowledge, unless you've gone through a comprehensive program that gives you really all of the pieces, there's the risk of getting sort of some of the information, but not all. And so the advantage of having that veterinary behaviorist is someone who has gone through a more comprehensive program. It's a bit more standardized to say, we have ensured based on our education process, based on our exam process, there's a base level of knowledge that exists across this entire discipline. There may be individuals who have similar attributes, but we can rest assured that with a certain level of certification, that is a standard that has been achieved.
Right. And that's one of the things that we talk a lot about on my channel, which is that the world of dog, just dog, is so vast. You could spend 80,000 years and still have more to learn, right? I never feel like I'm running out of conversations or topics or perspectives on my channel. It's always because there's just so much to know. And so a general practitioner veterinarian could know a lot and be very knowledgeable, and still have these little gaps of knowledge over here, right? But that doesn't necessarily discount their qualifications or their education. It just means that it's an endless amount of information, right? So as you kind of mentioned, you kind of touched on this, there's basically two different lenses. You can think of this, if I'm a dog owner, I might think of this like the physical lens, right? The medical end of the dog, and then the training protocol, the actual behavior change protocol, right? So we're going to break down those two just a little bit, but starting with the medical lens, why wouldn't someone, if I have a dog or a cat that is just starting to display aggression, why can't I just go jump right into a training protocol? Why would I want to see a veterinary behaviorist first?
Yeah, it's a great question. And the first element of that is, I think, a really important detail, because I think for a lot of pet owners, when you run into a problem, whatever that is, you know, whether it's the example that you mentioned of an animal who's showing aggressive behavior for the first time, you know, there is often that question of, who do I reach out to? Who is the professional that's accessible to me? And for many individuals, the trainer that they've worked with, perhaps through puppyhood or adolescence, may be one of the first points of contact that they have, or it might be their primary care veterinarian that they've worked with for decades with multiple animals. And those are great initial intervention points. I wouldn't say necessarily that someone says, nope, I need to wait 2 months until I can get in with a veterinary behaviorist before I even get started. But I want to make sure that unless we're getting a comprehensive evaluation, we might be missing things, or we might not have the full scope of that information. And so, you know, if we're starting from, let's say, the veterinary approach, and you take that animal into your vet and you say, hey, we're seeing some behavior changes here. Can we get this animal checked out to make sure that there's not a physical issue? The tricky part there for the general practitioner is that not all of the things that can cause behavior change or contribute to behavior change are going to be visible, even in a really thorough physical exam. So for example, if an animal is experiencing a level of discomfort because of gastrointestinal discomfort, whether that's inflammatory bowel disease, whether that's gastric reflux, whether it's chronic pancreatitis, we're not going to see that on a physical exam. We might, listen to the heart and the lungs, and we do our cursory physical, and we can't see that. And so, we're really relying on that veterinary team to be able to gather enough of that historical information and to understand how different medical conditions may show up as behavior, to really say, wait a minute, this pattern may be consistent with pain or discomfort. And so this is where we're going to go next. And that's simply an area that not every veterinarian has had that comprehensive education to really understand. And then flipping to the other side, where we work with the trainer, we may work with an incredible trainer or behavior consultant or behavior analyst who understands the hierarchy of behavior change and who understands reinforcement and different intervention options. And without that medical knowledge, they may not recognize, for example, that dog who's a little bit slower than average to respond to that sit cue is not being stubborn, or is not being willful, or isn't not intelligent, who is unintelligent in that moment, but is really struggling because there's a level of discomfort that exists based on physical changes or perhaps response to physical pressure in certain ways. And so it requires an eye there for the trainer or the behavior consultant to recognize, there may also be a physical underlying issue here, which also takes experience and education and knowledge that is typically beyond the education of even really good trainers or behavior consultants. And so we're asking sort of for that combined knowledge to really exceed what would typically be included within either of those educational programs, and to really work collaboratively so that we can investigate the things that are unseen and know when to push a little bit more on issues that might have a physical underlying cause.
Right. And I think another element of it, and the only reason this comes to the forefront of my mind is I literally just had a person reach out to me about 3 weeks ago who her dog was displaying consistent aggression towards her and her daughter. And she had taken her dog to the vet several times to be like, I think there's something, we need to check this out. We need to check that out. We need to check this out. And she said that her vet told her that he felt like he was a little flying kind of blind, where he was just like, I'm looking at the dog and we can run a bunch of tests, but it's like, really, we have to experiment, and unfortunately they ran out of time and that dog seriously harmed someone and they had to behaviorally euthanize him. And so to a certain extent, it's almost a little bit of a time saver if you can go straight to a veterinary behaviorist who can quickly wean through problems and you don't necessarily feel like you're flying as blind right out of the get-go. And then honestly, sometimes, especially as a vet, you see so many dogs that, especially puppies, that are displaying minor discomfort or distress in their life. And so you go through a quick training protocol and the dog feels better or the cat feels better. And it's like, well, we didn't need to do this extensive thing over here. If we can just make a couple of management tweaks and a couple life changes and the dog or cat feels better all of a sudden, we don't need to go through all of these expensive tests, quite frankly, right? And so from a vet perspective, you really want to make sure that you're not causing your patient to fork out unnecessary money, right? So there's a lot of playing parts here. But I think one of the sort of elephants in the room when a person kind of looks up VB is sort of the cost. And they're all of a sudden, they're like, whoa, because in their mind, they're still conditioned to believe like it's a normal vet appointment, right? They're like, whoa. So I'm wondering if you can sort of like speak to that. What really can they expect when they're coming to an appointment? And, it's not just a matter of a 20-minute sit down physical check and call it a day, right?
Yes. There's so many layers to what that question really sort of encompasses there, Jenna. And, I think what I can speak to is the way that I approach my cases. And that may be a little bit different from one veterinary behaviorist to the next. So I'm not going to claim that I can speak for the entire behavior college in this regard. But what I can tell you is that, for example, I'm seeing a new patient tomorrow morning. And so, I've got that patient's medical history in front of me. I've got an extensive behavioral questionnaire in front of me, and I'm going to spend, give or take 45 minutes to an hour on all of that information, depending on the layer of complexity. For some of the more complicated medical or behavioral cases, that, 45 minutes might actually be an hour and a half or 2 hours. Because I want to go into that appointment thinking, what do I think I already know? What do I need to tease out? Where do I fill in the gaps? What are the pieces that go together? What are the pieces that are outliers? Which are the things that make sense and start to inform whatever those concerns are for this particular animal, so that I can go into that appointment and within 20 to 30 minutes, in most cases, fill in those gaps, gather enough information that those little sort of tumblers start to click in my brain where I go, okay, I think I know where we're going with you, or at least I've got a really solid hypothesis about what I think is going on for this case. And so then I can share that information back to the owner and say, here's what I think is going on. Together, let's come up with a plan for how we're going to tackle that. And so that process on average for us takes about an hour and a half of dedicated time with the owner, plus the prep time ahead of time, plus the follow-up afterward to make sure that we're accurately documenting our observations to be able to share that back to the primary care veterinarian so that they know what we're doing. And then we're also available for that follow-up afterwards as well to say, now, how did that work? What did we do? How is it working? What does that tell us, both in terms of the animal's learning style, their underlying health or physical comfort, how they've responded to medication or supplement-based interventions, if that's something that we've chosen to incorporate, and how does that actually inform this process? And so I think one of the tricky things that goes along with that initial assessment is that I work with clients who, for example, we do that initial assessment, I give them some recommendations, and that's good enough, right? That gives them the information they need to know in terms of how to proceed or how to guide the primary care veterinarian or how to inform the training protocols that they're working on with their trainer or their behavior consultant. And so that one appointment may have been a game changer for getting them on the road to success and achieving those outcomes that they're looking for. Whereas in other cases, this may be more of an evolving process that may take us a substantial amount of time and potentially a substantial amount of financial resources. And I can't tell you which dog or cat is which until we dive into that process. So there is a bit of a leap of faith, if you will, for the average client who's saying, yes, I'm willing and able to be able to invest in that process, and I have the resources that I need in order to maintain safety and quality of life until such time that I can get that appointment. And I don't take that for granted, right? I know that for a lot of people who are in an acute crisis, waiting 2 months is simply not an option for them in their journey with that particular animal. And so I want to bring up one additional detail too, which helps us out from both a cost as well as accessibility of services basis. And that is, at least through the Animal Behavior Clinic here in Portland, myself and one of my other colleagues in the practice, who's also a board certified veterinary behaviorist, we actually set aside time in our schedule to be able to do vet-to-vet consultations, where for that client who is working with their primary care veterinarian and for that veterinarian who acknowledges that they're flying a little blind or not quite sure exactly how to put these pieces together, myself or my colleague can spend 20 to 30 minutes on the phone with them, running through the important details of that case, pulling together what we think those initial interventions are going to be, either as a way to help them guide that diagnosis and treatment plan, or to get them through that triage phase until they're able to get in with us or with a veterinary behaviorist that's perhaps more local to them. Mm-hmm. So it really cuts down both on the cost as well as the latency to when we can actually get that support to start guiding that process. And I don't know that I can speak for everybody else, but man, I love doing those vet-to-vet consults, and to be able to really help folks really everywhere around the world by really taking what I know and helping them to take the next step forward for wherever they're starting from with that particular animal.
Yeah, and that's definitely a sort of another problem that many people run into, is just by sheer numbers, it could be 100 miles to the closest veterinary behaviorist, right? Or then some. And so just by sheer logistics, you could not have a VB in your area. And all the more reason why seeing if one of those vet-to-vet consults could be helpful for you in your case, right?
Yes.
And this is perhaps a interesting question, but I can just tell you just from my own brain, I'm wondering, so I imagine some of the viewers would, would it make sense if I have a dog that is displaying aggression and I know that I can't get a VB, but I know there's a VB that does those vet-to-vet consults, would it make sense for me to ask my VOB or suggest and be like, hey, could I pay for a conversation with you and, Dr. Pachel or whatever, right? Would that make sense, or is that kind of overstepping a little?
No, I think it really depends on the conversation and the relationship that already exists. I think we can listen for some of those moments where, for that client, for example, whose vet told them, hey, I'm flying blind, or I've sort of exhausted what I know to look for, but clearly we haven't fixed this problem yet. that's an opportunity for any of us, whether we're the trainer or the behavior consultant or the pet owner, to say, if I knew of somebody who might be able to step in and give us a little bit of additional support, even from a distance with a relatively limited amount of financial or time investment, is that something that we're all open to incorporating into the plan? If so, cool. Let's reach out. Let's get that scheduled. Let's get that ball rolling.
Okay, cool. Okay, so, and you kind of touched on this a couple of times regarding behavior medication. And I think sometimes people just go in assuming that you're automatically going to prescribe trazodone and their dog's going to be a run on zombie dog and it's going to be a nightmare. And so they just don't even want to schedule, right? Don't even walk down that road. So what would you say to someone who's having that hesitancy right out of the get-go with behavior medication and all that?
Yeah, the best answer I can give is that from my perspective, at least, I'm way more than just a prescriber, right? If all I was doing was grabbing the prescription pad and saying, trazodone for you and fluoxetine for you and whatever the case may be, man, that's not the way I operate. So that's sort of the shorthand version of that. And I think there's also there's a lot of different ways that we could look at this conversation, even to say, guess if we are prescribing, using trazodone as the example, if that's the right medication for that animal at the right dosage, we generally do not need to create that zombie dog, that sedated dog, or even a dog where an owner is perhaps concerned that we're going to change the animal's personality through the process of prescribing. Yes, those are risks because these are powerful medications. And yet they are not needed in order to achieve the sorts of things that we're looking for. And I think that really comes back to me when I think about the primary role of prescribing behavioral medications. Behavioral medications do not automatically change behavior that exists because of the animal's learning history. They are doing because of their past experience. What we are often able to do with medication is to minimize some of the impact of those big feelings that are getting in the way of onboarding new coping skills, whether that's emotional strategies or whether that's behavioral strategies. If we're getting this interplay of, often that limbic fight-flight response that's creating panic or high arousal responses that are interfering with us getting access to that prefrontal part of the brain that's necessary for learning new patterns, we can use medications to reduce the impact of that emotional arousal, but that doesn't automatically teach or change. And I think that's one of the places that's often misunderstood. And if we're leaning on medication to suppress behavior, that's where we often get to the point of sedation. We get to the point of seeing dramatic behavior changes. And that's in most cases, a bit of an inappropriate or less effective way to think about behavioral meds. Behavioral meds, even those that are FDA approved for specific conditions like noise aversion or separation anxiety, for example, are designed to be used in combination with behavior modification principles. And so if all I was doing was prescribing, I really wouldn't be all that helpful. And on the flip side of things, if I am, coming to see a veterinary behaviorist, for example, I would want them to consider, is my pet a candidate for medication and why? What is it about this animal's learning history? What is it about what we've attempted already that's not achieving lasting success that makes my dog a candidate, or maybe makes them not a candidate for medication? I would want a veterinary behaviorist who's really walking in with curiosity versus saying, what is the medication that's going to apply here? It's really more a matter of saying, what am I treating? What are the environmental and social elements that are at play here? Is there a role for medication? If so, what does that look like?
Right.
And the veterinary behaviorist, in my opinion, should be able to have that conversation with the client or the veterinarian, rather than saying separation anxiety is treated with this drug.
Right.
It's more about saying, what am I really trying to accomplish, and what are the behavior modification or environmental management pieces that are being used in combination with those meds to achieve that lasting success.
Yeah, I think you hit on a really important word, which is that why. And I think just dog owners and cat parents, they should feel comfortable if a vet is prescribing any medication, but especially in the case of behavioral medication, if you're already kind of feeling sensitive, and don't be afraid to be like, okay, why this med? Why, why, right? Because, and honestly, your vet will probably, hopefully, welcome that question, be all excited, because they just don't get asked that enough, right? And they're like, yes, someone who knows questions, right? So if honestly, in my experience, most of the vets get excited when you ask them questions. It makes them more opportunity to have a conversation about something that they are passionate about, something that they love. And, not very often are they going to give you a lot of pushback and be like, why not? Well, what's your problem, right? Don't necessarily be too concerned about that. Okay, so we talked about the medical side of things. Now let's talk about the training protocol, right? Is a dog guardian or cat guardian, are they going to be able to come to you and also get a training protocol to help them, or is that something that they're going to have to go pay someone else to do as well, or what can they expect from that?
Yeah, the expectation there is actually a really hard one to predict because it varies extensively from one case to the next. It depends on the degree to which the client themselves has a skill set or a toolbox to tap into, knowing, as you know, behavior change is a skill, right? To be able to sort of know when and how many repetitions, and when to push criteria, when to make it easier, when to try something different, when to kind of take a left turn and do something completely outside the box. That in and of itself is a skill set. And so for someone like myself, if I'm doing that initial assessment, I'm usually able to determine where we're starting from. But once we get that momentum going, I don't actually know yet how the animal is going to respond. I don't know the owner's skill level or their level of discipline, or what complications they may have in their own life that are going to really require me to make a different set of recommendations. So generally speaking, if we're looking at a process of behavior change, I think it's reasonable to assume, or at least predict, that there's going to be an ongoing relationship that exists. Whether that's primarily with someone like myself, where I'm actively involved in guiding the individual recommendations for behavior modification, whether that is a collaborative process, which is very, very common within my practice, where either I'm referring them to someone on my team, one of my technicians, for example, or I'm working with our collaborative training partners at Instinct PDX, or we're working with the trainer that the client was already working with, and I'm able to say, cool, here's some additional guidance for you to run with. Here's some additional, decision tree moments that for this dog or this cat really feel relevant. Let me know once you've run down that path a bit, and then we'll revisit that and say, well, what else did we learn? What does that now tell us? So I do think that it's important to expect that there's going to be an ongoing process in some way, shape, or form, but that is heavily influenced by the accessibility of training support. It's heavily influenced by even the budget that the owner has. Meaning, if they say, I don't really have a lot of resources here, then my job shifts to, what can I make available to you? So are there online education courses? Are there videos that can fill in that gap? Knowing that that is not necessarily an equivalent replacement for working one-on-one with a trainer or a behavior consultant or a veterinary behaviorist. But if that's the best we can do, then that's the best plan for that owner and for that animal. And I'm not going to make them feel bad about that. I'm not going to give them any sort of guilt or grief about having to choose the option that is in fact accessible to them. And so what I want people to understand is that the process of making recommendations is not a cookie cutter. It's not a matter of saying, well, here's the way we treat this issue, take it or leave it. It's about applying those solutions and figuring out what is accessible to that pet owner so that we can start that process, and then setting realistic expectations. yes, if budget is limited, if time is limited, if we're working in a really complex emotional environment, that may start to affect what we can expect for outcomes.
Right.
And that comes into, to some degree, prognosis or expectation setting. And that gets complicated. And again, we can't always know what the outcome's going to be. I've worked with some cases there that, at the point of initial assessment, I think, wow, if we get 10% of improvement here, I'm going to be jumping up and down. And lo and behold, 3 weeks later, we've got a completely different scenario on our hands.
Mm-hmm.
And I've worked with others where, I thought, well, gosh, 1 or 2 little simple adjustments here, and we're going to be off and running. And, 3 years later, we're still going, what the heck is going on here? Why is this team not making progress?
Right.
So I try to be open to that as well, knowing that, gosh, I just don't know what it's going to look like until we dive in and get started.
Right. Absolutely. And in fact, that's honestly one of the reasons, like with our program, we give discounts to anyone who ends up working with a VB. And we do that regardless of if it's one appointment and then, like you said, it's like one and done, or sometimes, God love them, these clients are going back 4, 5, 10 times back to their VB, and that's frustrating for everyone, right? But I personally do like to take a team aspect. I know that every doctor has sort of their own preference and their own process, and that's everything. It's funny, as a consultant, I've worked with some veterinary behaviorists that are like, I want to know all of your notes. I want to see inside your program. Show me videos. Like, I want everything that you can give me. And then I have other people that are like, hi, bye. And I'm like, okay. So, it can go both ways, and it really just depends on what the individual doctor recommends and thinks is the best, necessary step. But also, I think from a consultant perspective, I can tell you, guys, please feel free to ask your coach if they would be willing to come at it from a team perspective, right? To ask your consultant, ask your trainer, are you willing to collaborate with my vet if they say that that's something that they're interested in? Because in my experience, the more we can kind of look at this, we have a bunch of teams in the room looking at this from your dog's lens, the better off your dog is. And so don't be afraid to communicate with your coach or your consultant or your trainer, whatever you want to call them, to see if that's something that they're interested in. But definitely for our part, we are always interested in collaborating with the doctors, for sure. Give us all of the people. Okay, so, let's start here. First of all, how would someone go about finding a veterinary behaviorist? And if they can't find one in their local area, or for that matter, their country, what would be the next step?
Yeah, the easiest place to start, at least for the American College of Veterinary Behaviorists, is going to the primary website, which is DACVB, so Diplomacy, the American College of Veterinary Behaviorists, dacvb.org. And there is a Find a Behaviorist locator on that site. And, as you mentioned at the very beginning of this conversation, there's not that many of us. Right. And so it's tricky, especially when that, less than 100 are certified through that American college, and quite a few of them actually practice outside of the continental US. We've got a small handful in Australia. We've got a cluster in Western Europe. We've got several in, I think 7 or 8 in Canada. And so, that number, even in the continental US, starts to really whittle itself down pretty darn quickly. And so I think about Portland, for example. We currently have 4 veterinary behaviorists in Portland, which is amazing. I love it, love it, love it. And yet there are none in the rest of Oregon. There are none in the state of Washington. There are none in Montana. There are none in North Dakota or South Dakota. So basically, if you go east from me, you've got to get all the way to Minneapolis before you find another veterinary behaviorist, unless you start to drop into California or Texas. So don't be surprised if someone looks at that and they're like, oh my gosh, there's nobody where I am. Where do I even begin? If there is someone local to you, awesome. Then that's likely going to be your best option. If there's not someone who's local, then the question really is, what's going to be the best way to work with someone who is a veterinary behaviorist? Is that working collaboratively with our veterinarian through that veterinarian to veterinarian consult service, where someone like myself can inform that process, but I'm really not having a lot of contact with the pet owner themselves. Or in some cases, depending on individual states' recommendations, and right now we're still operating through this COVID-19 protocol shift with doing a lot of telemedicine work, there are ways that we can effectively advise pet owners, still working collaboratively with the primary veterinary team, but there are ways that we are able to work directly with pet owners. And that's something that my practice offers. There are several other teams throughout the continental US that are willing and able to do that as well, based on their own state statutes and how they've chosen to set up the structure of their practice. So it may take a little bit of legwork, may take a few calls, it may take a little bit of time on the phone or an email to figure out who's available and how that works and what the best option is, but it's time and effort well spent.
So, I think we've kind of covered everything in general terms, but is there anything else that if I'm going to go have my appointment, it's scheduled for 7 weeks from now on Tuesday, right? And I'm sitting around waiting for my 7 week from now appointment. Is there anything that you would like me to know about the appointment or about the process that we haven't covered yet, or just in general terms?
Yeah, I think one of the things that comes up probably more often than anything else is, let's say we get to that appointment, 7 weeks comes fast enough. And now I'm sitting in the office with my client. I'm saying, cool, over the last 7 weeks, how often has this issue happened? You've got a dog that panics with storms. How many storms have you experienced that actually caused a panic episode? Do you have video of what that looks like? Because we're not going to replicate a storm here in the office today, or if I'm on a Zoom call with someone, we're not necessarily seeing the animal in those moments. So do you have video that you can gather safely for everyone? We're not intentionally trying to elicit any sort of unsafe or emotionally damaging scenarios just for the purpose of video, but can you gather some additional information that when we get to that appointment, if I say, you know what, I think I understand what's going on, but man, if you had an example that would really clinch that for me, that would be amazing. If we'd be able to take a look at the body language or really get a better sense of how that particular animal responds in the moment as you're trying to distract, or you're trying to comfort, or you're trying to ignore and just see what happens. Seeing that in real time is absolutely informative for us, both in terms of understanding as well as also knowing what to do next. So journaling doesn't need to be a daily 7-page entry, but a couple of data points about your concerns. What are you seeing? What works? What doesn't? What are you trying? How does this go? Is it better on days when you've exercised the dog? Is it worse on days when you've exercised the dog? What are you seeing?
Right.
And we can then pull that information into the consult itself.
Right. Yeah, I think, to emphasize one more time what Dr. Pachel just said, it's video safely. We're not deliberately putting the dog into a situation where they may aggress or harm someone or hurt themselves just to get a video. Like, that's okay. We're got it. But yes, if you can kind of set it up safely and we can see what, especially if it's an unusual behavior where you're like, what in the world is happening here? Like, right. The more we can see it, the better. But yeah, you kind of touched on journaling, and sort of, you don't necessarily need to know that it was a Tuesday and that the sun was shining and that the breeze was warm, and we don't necessarily need to know that. But what are some specific things that if I'm waiting for my appointment, and let's say my dog is doing a behavior super randomly and I can't seem to find the correlation, what would be some things that I would write down to journal?
Yeah, so it varies a lot from one pattern to the next. I mean, that's the reality of what we're dealing with. And so I also find that, you mentioned some of these things, like it's Tuesday and it's a sunny day. It's entirely possible that that's actually a relevant detail, right? If Tuesday is trash day and the garbage truck is in the driveway, that might actually be the antecedent condition that's eliciting that behavior. So that's the tricky part about journaling, is that I don't necessarily need the play-by-play of your life story. But let's say the dog has an episode of whatever that is. It's barking, it's drooling, it's a panic type episode, whatever that happens to be. jot down a couple of notes. It is Tuesday, it's 10 a.m. It's 2 hours since the meal time. We just had a visitor at the door. Basically, it's whatever we take to create a little snapshot of that moment. It doesn't need to be every single detail. Sometimes we're even able to just get a couple of those data points down so that if I need to ask you additional questions, you remember, oh, that's right, that was the Tuesday episode right after the mail carrier arrived. Awesome, I now can sort of rewind back in my mind and we can dig into that a little bit deeper versus, gosh, something happened in the living room 2 months ago and I just don't have any recollection of what that was all about. Right. So just give me a bit of a snapshot of what that situation looked like from your perspective. And that's a good starting point. When we get to the consult and I have a better understanding of what's going on for your dog, I can probably refine for you what exactly we're going to want to journal as we go forward, if we're still trying to tease out the pattern or we're trying to get a sense of, whether our interventions are making a difference or not.
Okay, is there anything that we haven't talked about that you feel we should touch on a little bit?
I think we've got a lot of the good information here in terms of, what the veterinary behaviorist can do, how they can work with the pet owner or collaborate with the veterinarian or collaborate with the trainer or behavior consultants. I think the only other thought that comes to mind for me is sort of the question of sort of when to reach out. And what I mean by that is, I have clients who reach out to us first. They haven't worked with a trainer. They haven't even gone into their primary care veterinarian yet because they understood the value of getting in touch with someone who understands all of the pieces. And they're like, you know what? I'm not going to waste time. I'm not going to mess around. I'm going to go to you and let you guide the process. Cool. I'm happy to do that. And I have a lot of clients who have started with their trainer, with their behavior consultant, with the behavior analyst, with their veterinarian, with their, whoever is available already in their sort of circle of influence. And so I wouldn't say that one of those approaches is better or worse. To some degree, it's whatever feels the most comfortable or most accessible to that individual. And not necessarily saying that the veterinary behaviorist should be a last resort, or that they should be the first stop. It's really, what do I need right now? In fact, if the client's saying, gosh, you know what, I can wait 2 months in order to get my dog into the veterinary behaviorist, but I can also take my dog into the veterinarian, get a clean bill of health and get some baseline lab tests run just so that we're sure we've got a healthy baseline. And yeah, I can start working with the trainer. We can revisit some of our protocols and make sure the dog is sort of fluent in some of the basic behaviors. And we've got our management and our safety practices dialed in. Like, these are all things that can happen concurrently, when we're getting to a point where we can pull all those pieces together. So there's not really a right or a wrong answer as to when to reach out, but as soon as it makes sense, yeah, by all means, reach out to your VB, see what it's going to look like to get an appointment, and then we can start the ball rolling.
Right. Yeah, I completely agree. I think it goes both ways. Sometimes I have leads that will come to me and they'll tell me about it, and right on the first thing I hear is like, you need to talk to a veterinary behaviorist, right? But that doesn't necessarily say that that person can't start doing some management things or some cleaning up in the meantime while they're getting those things ready. And to be honest, if you guys are working with a consultant who is able, ideally, that consultant is able to work with the VB's timeline as well, right? So if there is some, especially if you have medications that take some onboarding time, sometimes there is a little bit of a standstill, right? We get to a certain point now, it's just sort of a waiting game for the vet appointment or for the meds to fully kick in, and then we can really jump right back into the training element of it. And I've never met a consultant that wouldn't be willing to wait, given good reason, right? So most consultants, I imagine, would be like, yeah, I'm not gonna abandon ship and be like, good luck, see you never, right? We're gonna wait around. We're in this to help you. Well, so where can people find more of you? I have a whole bunch of resources down below, but if someone wanted to learn more about you, where can they do that?
Yeah, the two best places to track me down, one is through the Animal Behavior Clinic. And so that's the animalbehaviorclinic.net. That's going to give you information about sort of what we do at ABC here in Portland. That's going to give you bios on myself as well as the team. We've got 4 doctors at the Animal Behavior Clinic who are ready and waiting and able to see clients and to really help work in those collaborative ways. The other place is looking at drpachel.com. And if you go on that website, you're going to get a whole lot of additional backstory about the other projects that I work on as well. And if you're looking for more recordings, whether that be podcasts or you're looking at videos or articles that I've written or co-written, all of that's going to be correlated, or it's going to be collected under that media tab on that particular page. Feel free to dive in. There's some great resources there. You're also welcome to reach out on social media. I'm happy to do that. My only caveat there is if you're tracking me down on social media, I'm a pretty public person, which basically means, if you're following my Instagram, yeah, you're going to get some dog stuff, you're going to get some cat stuff, and you're going to get some running stuff. And I really like beer and I love the Portland food scene, and you're going to get a whole lot of all of those things. So if that's your jam, then I'd love to have you along for the ride. My only request there is reach out and introduce yourself. I'd much rather know who it is that I'm connecting with in those ways versus just having a whole bunch of people sort of out there in the collective ether that are just sort of hanging out. So feel free to introduce yourself. I always appreciate that.
Yes, absolutely. I love hearing that. That's amazing. Most people don't want people sliding in their DMs or anything like that. So that's impressive.
Yeah, I don't have a ton of time to respond,
Right,
but
yeah,
I will always respond. I can't do a lot of direct consulting that way. That all gets redirected back into the practice. But
I was just about to say the same disclaimer, like, okay, but also don't come into our DMs asking us to help you with your dog directly. Like, we're going to talk in very abstract, general terms if you do that.
Yes, no, that's a great point, Jenna. So if any of the posts starts out as, so this dog is 2 years old, we're going to hit a pause button on that one because I can't help you through social media. The DMs are not going to work for that.
Yeah.
If it's a matter of saying, hey, I love that podcast, keep doing what you're doing, my name's Susie, awesome, like that's great for me to get behind. Love it.
That's awesome. Thank you so much for your time. I know you're very busy, so we really appreciate it. And I just adore you so much. I think you're so easy to talk to, and I really appreciate that, honestly. I really appreciate that. And I'm so grateful for your time and for all of your effort to help dog people and cat people all over the world.
Well, thank you for that. And, as we said, when we were getting this recording all squared away today, I absolutely have the utmost respect for folks like yourself who are making the effort to put this content out there. I don't think that most people really have a full understanding of just how much work has to happen behind the scenes to put channels like this together to really deliver content. So thank you for doing what you do as well. It takes a village. It's a collaborative effort. Go team.
Yay, go team. All right, my friends. Thank you so much for your time and have a wonderful day, okay?
Take care.
Bye.